My name's Dr. Paul Williams and I lead the work here in the CCG, commissioning mental health services and services for people with learning disabilities and people with dementia. Our dementia challenge in Hartlepool and Stockton is huge because as people live longer, more people develop dementia, usually older people. This has a big impact on them, the patients, but also their families and their carers. Only yesterday I saw a patient in my GP practice who's just been diagnosed with dementia. I saw her with her daughter and we talked about the challenge of helping her to live safely and independently at home. In the CCG we're working to better recognise dementia in the community, commissioning really good quality memory clinics and encouraging GPs to refer to them, but also improving the communication back from the memory clinic to the GP. Our ambition is to get more people with dementia to be diagnosed earlier so that we can help them to stay well for longer. We're also working with people with more severe dementia who live in care homes. In many cases, if these people, residents in care homes, get ill, then they're admitted to hospital. And if they're admitted to hospital, they often have worse outcomes than if they were cared for in their care home. They get frightened if they move into a new environment, and especially if there aren't familiar faces around them. So we're helping them along with the care home staff, their families and their GPs together to make emergency healthcare plans so that there's a plan so that in the middle of the night, if they do get ill, the answer isn't always to call an ambulance and rush them into hospital. Sometimes they can be better cared for where they live. This reduces unnecessary admissions to hospital, but it also really improves the quality of the care that they get.